Well, good evening, everybody. Thank you for joining us for this lecture, and thanks for your interest in OcuPlan recently. I have to say about financial interests, as I'm medical director for OcuPlan, and founded the company a few years ago with the help from Vicky. So this first slide's a bit wordy, I'm sorry, but there's just a few things to cover. So OcuPlan was started really to make shared care in the private sector more organized and efficient for professionals, but also more cost effective for patients. And I'm not sure if you all know, but around 5 years ago, I left the NHS to be a full-time private consultant. And over the past 5 years, I've become increasingly aware of trends in private ophthalmology and optometry, and also in the NHS, and how they changes in the NHS have an impact and affect the private sector market. One of the things we've seen locally is the rise of sort of virtual or commissioned sort of third-party services, which are trying to solve some of the capacity issues in the NHS. But quite often they do create problems further down the line. It's almost as though the problem is sort of kicked down the road for a while until the next round of commissioning. And I've seen this at first hand in the private sector, as patients often turn to the private sector for help and support. And really what they're often looking for is face-to-face continuity of care. But as we all know, private medicine can be very expensive. So in contrast to this, what we're trying to do with OcuPlan is to provide a high level of quality, continuity of care at the consultant level. And by doing it at the consultant level, it creates excellent clinical governance. And in contrast to third-party providers who often may use doctors from different regions or not consultant level doctors, the benefit of the OcuPlan is that it's your local NHS consultants that people are seeing, and that provides much better harmonization. And as the service started to develop, we realized that that we were attracting a new middle ground cohort of patients. And these are people who wouldn't necessarily think about going privately and be perhaps put off by some of the fear of the upfront cost as to what involved. And so by trying to make it more affordable, we were able to start attracting a new cohort of patients. And this has been gradually building over the past couple of years. Now, also by making it more affordable, patients are allowed to have scans at every visit. And so you end up capturing more data. So one of the things that I was finding with my private patients is that I would perhaps only do a set of investigations once a year and maybe see them twice a year. But for less cost for the patient, I was able to have 2 sets of tests per year through OcuPlan. And so all of a sudden you can spot trends better with data, and it becomes an easier process. Now, OcuPlan was started by myself and Vicky for my practice, but in order to help other people benefit, we've had to start to build networks of ophthalmologists and optometrists. And at this early stage, doctors and optometrists will join, and it can take a bit of time before they start to see patients and start to gain traction. The idea of building the network is that we're effectively using pre-existing infrastructure, which is a very efficient thing to do and less wasteful. And we're trying to solve capacity problems without having the need for institutional investment in sort of new buildings, new premises, and new ways of working. For me, during lockdown last year, our private hospital closed for 4 months, and I had to set up some rooms in a local GP practice. But thankfully, because of OcuPlan, I was able to see patients with relatively low setup costs. So I had to buy a new slit lamp, but we were able to see OcuPlan patients, and they were able to get tests and investigations at optometrists. So it does present this ability to generate good recurring revenue in a relatively low upfront cost way. Now, as things have progressed over the last year, there's very much a medical and educational aspect to OcuPlan, and we know that the roles of optometry is developing in the medical sense, and I think OcuPlan provides a really good base to try and support that. So we're starting a lecture series looking at visual field analysis, OCT analysis, and covering common conditions. And my vision and hope is that eventually different consultants from different regions will do that to support their local optometrists. And as we delve deeper into how to make a shared care system work, we realized there were quite important medical legal aspects to this. So quite early on, OcuPlan was able to obtain medical legal insurance from the MDU for running shared care pathways in the private sector. And we've also been extremely careful to adhere to the GDPR data protection regulations, because the fines for not adhering to data protection can run up to 4% of your annual turnover per year. So it was extremely important that the systems that we put in place help to keep patients, optometrists, and other consultants safe. So what OcuPlan does? Well, effectively, it provides packages of shared care for known disease. So patients know what they need per year and are able to get that amount of care in an organized way in a cost-effective way. We purposely didn't create too many different packages because we want to try and align patients' thinking with their current care. So if they're normally seen once per year, then they would go on the basic scheme. If twice per year, they go on the Care Plus, and the premium would be three visits. But the idea is that people can always purchase additional services if they're required. So we tend to find that most patients join the Care or the Care Plus level. We also thought about whether you have a disparity between visits and a number of investigations, and felt that actually that creates confusion, because sometimes patients could turn up to the optometrists just prior to seeing their consultant, but not realize that actually they weren't due a set of investigations. So to keep it simple, we aligned the number of investigations per year with the number of consultations. And we find that just helps remove any confusion. So when patients arrive at their optometrists, they get a visual field test and OCT scan of the disc and macula. And again, we wanted to do a standard set of OcuPlan tests, because we found early on, when we were trying to have separate visual fields or OCT, or a glaucoma or a macular OCT, that it creates the need for quite a lot of data sharing and interaction and confusion about sometimes what tests need to be done. And in a busy clinic, busy optometry clinic, it's just easier for everybody if we just think of a set of OcuPlan tests, which is a complete set for everybody. And also it's quite a good way of screening for other problems. So the results are emailed as a static report to the patient's consultant using a secure nhs.net or egress password protected account. Now we're developing version 3 and version 4 of the website at the moment, and in future we'll be able to upload these, the optometrists will be able to upload the results of these directly to the website, with the idea of making it a little bit easier for everybody. I know that IT projects, we all have experience of IT projects going right and going wrong, and so that just needs to be done in a phased way to make sure it works well for everybody. And then most importantly, patients get a face-to-face clinic with an ophthalmologist in their private rooms. And this is where the high level of clinical governance comes in, because that continuity of care at that high level is really what patients value. So effectively, we have a flow chart here. So we have patients who are able to use the website, which provides automated registration, payment, and practice monitoring. Or we find it's an extremely powerful way of converting, like a conversion optimization, is to simply say to patients that they can join over the phone in 2 minutes. And actually, that's been an extremely popular way for patients to join, perhaps due to the demographic of that patient group. Most choose to pay using installments, and when this offers an ability for patients to spread the cost over the year, and it aligns well with patients' income post-retirement, which is often based on a monthly amount of a pension. And most choose the basic care or care plus level to reflect their previous care needs. And if there's any doubt, sometimes patients find the suitability checker on the website useful. Now, importantly, after they've joined, there is a 14-day cooling off period, which is required by the Provision of Goods and Services Act, which is the legal framework under which OcuPlan works, for patients to consider their purchase and cancel it free of charge if they need to. So we're currently on version 2 of the website, but version 3 of the website is coming out shortly. It's been built from the ground up by our IT team and represents grade A code, which I'm told cannot be improved upon. And this is great because it means that we're starting from a very robust baseline. The website has this ability to do multi-input search functions. So you can search for a postcode, a name, a consultant's first name, second name, town, a postcode, and it allows people to find the person they want quickly. There's a document section, which is a separate system, but which allows us to update the document system or the website as we need. And that includes all the various frequently asked questions and terms and conditions and guidance for imaging. And then we also have Facebook, Instagram, and blog pages, which we try to encourage you to share new news on. So the new version of the website has the ability to set your practice profile. So this is mine that we're working on at the moment, and we'll be able to do the same for all the consultants and optometrists. Effectively, photographs are really useful, a short biography and contact details. And these are what will come up when the patients are searching for consultants or optometrists. And this is an example of a patient's account. So when they go on there, they can see their optometrist, how to contact their optometrist, how many tests that are remaining that year, and the same with the consultant. And also there's a copy of their membership card, QR code if needed. It allows the patients to keep track of their entitlements. If they on a twice per year, that means they get one set of tests per 6 months. It doesn't mean that they can have 2 sets of tests close together. If patients require any additional tests, then that can be funded in the traditional way, usually as a self-funding patient, because these patients are effectively self-funding patients. So we advise patients and optometrists and eye doctors to recommend to their patients to go for the minimum known services you need per year. And that's how you can use the service in a cost-effective way. So how do you trigger payments? Well, when a patient comes to clinic, we've asked patients to phone ahead to say that they are OcuPlan patients. So early on, we had issues with patients turning up to the optometrists and saying that they come for a sight test, but not saying they were with OcuPlan. And so then obviously we found out, and the patient then had to go back and have a set of OcuPlan tests. So we generally ask patients to phone up before and say that they're with OcuPlan, and please could they book in for a set of OcuPlan investigations. They'll bring with them their membership card, which is scanned using the kiosk function, and that can be uploaded to a tablet device or a mobile phone. And that automatically triggers the payment processes. So for optometrists, they get paid in full in 2 to 3 months from scanning the card. We have a payment run on a certain date every month. For ophthalmologists, they get paid in full straight away if the patient has paid in full. But if the patient has paid installments, then the ophthalmologist also gets paid in installments. and they can track their payments on their account. So this is an example of my account for one of my practices. And you can see how it tracks the payments and the scanned cards. So the bar charts are what's been scanned each month. The line is the outstanding payments, and then the block at the bottom, which is running along the bottom, is the total paid. So as time goes on, the line comes down and the block goes up, and each month you can see what you've scanned. Now you're able to print out each month's statement, so you can clearly see every month what you've been paid, what's outstanding, and this makes it very easy to calculate your annual tax returns, which, you know, from someone who works full-time in the private sector, it can be quite a difficult time of year when you're trying to bring all your receipts together. But the nice thing about this OcuPlan system is that you're literally able to print them all off, add them all up, and it's really easy to do. And you can see an expanded view here where it goes through specific days of who's been scanned and how far along the treatment timeline that they are. The website documentation section covers some of the issues around quality control for visual field tests, for instance. This is what I've just given a screenshot example of here, talking about fixation losses, false positive, false negatives. I mean, clearly, optometrists are extremely experienced when it comes to performing these tests, but we needed some way to have some guidelines as to when tests might need to be repeated. Part of the governance around being under the Provision of Goods and Services Act is that effectively we're paying for a service, and that service has the ability to be has the option that it can be repeated if it falls short of a certain standard. Now we've generally found that the optometrists doing the tests have been incredibly vigilant and about doing good quality tests, such that on a number of occasions I've had optometrists call me up and say, look, I'm really sorry, we've tried really hard with this OCT, it's the best we can get. And I've looked at it and I've gone, wow, that's better than the one we've done in the private hospital. So generally speaking, the quality of the test is not an issue. But sometimes there may be patient factors like poor media, for instance, or a very high myopic retina and tilted optic nerve, and that will give rise to difficulties interpreting OCT scans. So in terms of payment systems, this is a slide really just to reassure everybody that the payments are via a third party called Stripe, and Stripe is the market leader in internet payment services, or one of the market leaders in internet payment services, and that we don't hold your payment details, so they are held securely. And if Stripe ever has a system, then I think, you know, it's going to be pretty bad for a lot of the world. So I think it's unlikely that that's going to be an issue. The online account that you have can be used to track the payments, and you can update your payment details anytime. Importantly, there's no need to invoice because the payment is triggered by scanning the membership card. But on the day, if you are having any issues with that, you can just call us and we can activate that centrally from one of our administration accounts. So this is a slide really to talk about where we're going with OcuPlan, because obviously it's required upfront investment to drive these efficiency gains from an automated website, the various processes of billing and taking payments and processing that, trying to reduce some of the bureaucracy and trying to help use infrastructure already in place. Has required upfront investment, but we're in a situation now where effectively patient installments are able to be directed to the people doing the work. And this is in quite contrast, this is in sort of stark contrast really to a lot of systems put in place for dealing with problems with capacity, which tend to have quite a lot of costs orientated around the management side of things, and paying for equipment, paying for room space, and often very little of the money goes to the consultant or the optometrist. You know, we've all been in situations where we're asked to do waiting list initiatives, or to do a visual field tests as part of NHS contracts. And actually the payment to the professional doing the work is often the thing that suffers. And right from the start with OcuPlan, we're trying to direct as much revenue as possible to the people actually doing the work. And that's how we're trying to maintain quality. But there comes a point where, in terms of growth, there's two types of growth really, and there's growth from marketing that OcuPlan can do, but there's also organic growth. And we're hoping that, and what we're seeing actually is that we're getting organic growth mainly from optometry at the moment, and also from and less from consultants. But I think as consultants start to become more familiar with the system and trust the system, then it's likely we'll start to see organic growth from consultants as well. And then that can be supported by growth from marketing. Now, the setting of fees is an extremely delicate issue, and there have been numerous examples in the media where the Competition and Markets Authority have had serious concerns, particularly in ophthalmology, orthopedics. It tends to be related more to medical professions which have a more established private practice orientation. And we've been extremely careful to keep on the right side of the CMA. We have these two really important principles: that we reflect market prices and we do not dictate them, and we also make our decisions independently, and so that we're not price fixing or forming cartels. Essentially, we need to be extremely sympathetic to regional variations in fees. We need to be compliant with the CMA guidance. And so we've set our fees based on average market prices for these services. Now, there's a couple of things to be aware of, because for optometrists, sometimes you see scans, OCT scans being sold as add-ons to eye tests. And of course, the patient's already come in and paid for an eye test. So if they add on an OCT for 10, 20, 30 pounds, that's very different to a standalone OCT, which is part of OcuPlan. And so what we're doing with OcuPlan is we're purchasing a standalone set of tests, not an add-on to an eye test. And therefore, we've had to base our fees around the average prices for standalone tests. For consultants, again, we need to be extremely careful to not cause inadvertent inflationary pressures on fees around the country. And to keep ourselves safe, and to keep everyone safe really, we've chosen fees which are at the lower end of the average range. So we're generally trying to save money for patients, and we're in no danger of causing inflationary pressures. So where do OcuPlan patients come from? Well, we are in the process of initiating our quite an extensive marketing campaign, and we've been working on a marketing plan for some time now. Our aim really is to become a household name, so patients recognize OcuPlan like they recognize Denplan or Bupa. And we want patients not just to join OcuPlan for the ability to save money, we want them to join it because they get high quality care. Patients need to be looked after, but I think what we're really aiming for is that they want to be part of something like this. Now, we've found from our experience that patients are most likely to join if they hear about OcuPlan from a position of trust. So they particularly trust their optometrists, their consultants, and if it's something which you feel would benefit that patient, then coming from you will come from that position of trust. And that's part of our job really, to look after you as part of the service. We're moving towards more of an illustration type marketing display. So previously we've had photographs, but we're gradually transitioning to images like this, which we feel are able to communicate our principles easier. So how to start growing your practice? Well, we've looked at people who are growing their practices and tried to work out the sort of things that help. From my perspective as a consultant, I was able to identify patients in my own practice who I felt could benefit from OcuPlan. It was great to get more involved with local optometrists. Really nice to engage them with the shared care process and the medicalization of that. And patients really appreciate it. They appreciate being told, the honest truth about you can have these tests done, you are saving money, and you're helping your local optometrists. We all know that some of the costs of scans and visual field tests in private hospitals can be extremely high, and there's no real way that can be challenged. I mean, I've tried several times to say to various hospitals I've worked at that the fees are too high for those tests, but they are set by the hospital, and that's what they decide they want to do. Now, if I see a patient who I think could benefit from OcuPlan, I always ask them who their optometrist is first. I think it's incredibly important to maintain loyalty and trust, and recurring revenue for optometrists is very important. So the last thing you want to be doing is recommending or telling a patient about OcuPlan if their optometrist is not on the scheme, because I don't think that's very fair. If the optometrist is not on the scheme, I normally give the optometrist a call and say, look, we're interested in this scheme. And do you have an OCT visual field test? Is it something you'd like to look at? And you can always get back in touch with the patient later. If, however, the patient's optometrist is on the scheme, then I normally just give them a flyer, and it's when it's their choice to pursue OcuPlan. Patients like to hear things like it's simple and easy to join over the phone in 2 minutes. That's we find is quite an important way to optimize conversion. In terms of figures, we've talked in the past about OcuPlan saving up to 50% of their fees per year on private hospital fees. On average, it works out around £200, which is a significant amount of money. And with that money, they're able to put that aside and use for other things. So I had a patient recently who joined, and because he was on the twice per year scheme, he was saving about £450 a year. And he actually said, I'm going to book in for my Wellman check downstairs with the money that I've saved. So the private hospital then gains from the footfall as well. And we often find that if patients feel that they are making good savings, then that just increases their bond to you and to the private hospital, so that you maintain their first choice for other treatments. So all the stakeholders in the process do benefit. Another thing to say is it's really important about the interest-free monthly installments are at no extra cost. So a lot of the times when you can pay for a service by installments, it ends up costing you more than if you could just pay for it all in one go. And we're very careful at OcuPlan to not do that. If you pay in installments or you pay all in one go, it's exactly the same. So as growth starts to happen, we're trying our best to support growth. So we've introduced the OcuPlan quarterly growth support scheme for optometrists. We are aware that as an optometrist does more investigations for OcuPlan patients, then that comes with costs like allocating clinic space and time, and also servicing and maintaining equipment. And so this is calculated per quarter and paid out as cash the following month. It's all kept track of automatically on the website because we're able to see the net growth per quarter and process that. We're also trying to support growth for patients. So there's a refer a friend and receive £25 off your OcuPlan package, which has been really popular with patients. They're very pleased about the service they're getting, and they want their friends and family to benefit. So we're seeing more growth from that aspect. I mentioned earlier in the talk about educational events. So the idea is to try and run a sort of reminder lecture stroke educational events about some of the types of conditions that OcuPlan patients suffer from. And we've applied to the optometry and Royal College for CET points so that these sessions can be used as part of your annual training requirements. Okay, so we're just coming towards the end of the talk now. So this is the current OcuPlan network. So the red dots are the consultants, of which we have 85 consultants signed up now. The dark blue dots are the optometrists who've registered. The yellow dots are the areas which we've seen the most growth. So these are actually the areas where OcuPlan started in the West Midlands. And the light blue dots are optometrists who are also seeing rapid growth. And the reason for showing this map is hopefully you can get an idea of where you fit into this picture, because there will be consultants who are not well surrounded by registered optometrists. And this is where we can help, and also you can help, because there is some onus on professionals in terms of organic growth to contact local optometrists that they work with and make them aware of the scheme and ask if they want to join. Because really all the stakeholders in the process benefit from this. Patients benefit from it, doctors benefit, optometrists benefit, and private hospitals benefit, because it means more footfall for private hospitals and that feeling that they're looking after their patients. We're also working hard to try and grow these networks, and we are trying to focus on the areas, but I think it gains much more traction if you're able as professionals to call your colleagues and talk to them about it yourself. And really kind of the main message is that we're trying to attract a new cohort of patients, these people in the middle ground who wouldn't necessarily normally go for private care, but through OcuPlan are able to access private care, really high quality premium private care, seeing their consultant with that continuity of care in a way that really they've not been able to do before. So despite the relatively lockdown situation of the COVID pandemic, I think as things start to improve this year and next year, we'll see a lot of patients who will need to turn to services like OcuPlan to get the care that they need. Okay, so just to summarize then, so OcuPlan started really with just one ophthalmologist and one optometrist, and originally when we set it up, it was just a paper exercise with terms and conditions that I'd written, and we've had it wasn't a scalable system, but over the last year we've worked really hard to create a fully scalable automated system so that other people can benefit. It's really focused on trying to make sure that revenue finds its way to the people doing the work, so it's quite honest from that perspective. We think it's a better way to provide care for patients who need long-term monitoring, and we hope it becomes a more recognized day-to-day brand. We really have been hammering home efficiency gains at every stage. So where possible, we use financial technology and automated software. And as I said before, we're trying to make it available to a whole new cohort of patients in the middle ground. And we find that patients really enjoy it and like it, but they have to know about it. And if that knowing comes from a position of trust, they're much more likely to move forward with it. I think our marketing plans over the next year are ambitious and exciting, and I think it's going to be a really, really great year. As I said earlier in the talk, the first stage in building something like OcuPlan is to create a network of trusted professionals, consultants and optometrists who are able to offer these high quality services. And I feel that we're there now with that. It's taken a long time, it's taken over a year to do that. And I appreciate you sticking with us during that process. And I think growth will come as as the country starts to recover from this recent healthcare crisis. Okay, thank you. That's the talk over.